I spent a number of years as a ward sister, working on wards, working alongside patients, developing my experience, my knowledge base. I feel absolutely passionate about nursing. And although I wanted to continue working with patients, I felt that my career should progress towards education.
I've never done an exercise like this before, so I'm going to start with just a short introduction, that's all.
This is the Skills Lab, where we have students who come in to practice clinical skills. These students are doing a degree in nursing, so they're doing a Bachelor of Science in Nursing. All nursing in England is going across to degree status from 2013, but we were one of the very first universities that have been asked to run the course from 2011. And what we do here at Kingston University is that we actually set up simulated exercises which actually bring in role players. So they're working alongside people who can provide them with feedback. And we also get the professional nurses who come in who are actually working out in the real world. Students feel that when they walk into that simulated exercise that it feels like reality, like a real ward.
And I'm just going to tell you a little bit about those patients there, and then I'm going to hand over, we'll get you organised into pairs, and then you'll work with the patients, and you'll find we'll give you a little bit more handover as we get to the clients.
None of the role players actually have any formalised acting, but they've developed their scenarios.
Mrs Bennett has been with us for quite some time, for about 3 days now. She came with a chest infection, and we've treated her with intravenous antibiotics.
And what the students should be picking up is that, in fact, although she's had some treatment, she's not really had very much confidence in herself, and she needs to be moved along quite quickly.
In the middle bed is Joy Person. This lady's just returned from theatre. Okay. She came into A&E earlier on this morning, and they diagnosed that she had appendicitis.
And the students need to now be able to care for her in that sort of post-operative period. And then we had a third person, a gentleman who'd fallen over this morning and had fractured one of his large bones, his femur. So the students were managing that patient with a fracture.
Jay, you'll be working with me with a patient in bed 2. And you, the two of you, will be working in bed 3.
Clinical practice is highly stressed area. Making mistakes is not what we want them to do. But in the labs, hopefully they feel safe enough in order to push themselves forward to actually practice skills that they perhaps wouldn't take on in the real world. And there's real learning there for the student.
I'm Jay, I'm the student nurse on shift today. So Joy, I'm just going to touch your leg, okay? Okay, is that all right? Yes. Okay.
And how is your cough? It's still there, but it's much, much better, thank you.
You will find that other students, perhaps at other universities, will not experience the type of simulation that we provide for our students. We can use mannequins, but a mannequin doesn't give feedback. It doesn't say, ow, or that was sore.
Do they do different size bags? They do.
What we want the students to see is the best practice. So we film the exercise, select certain clips, and then put it onto study space for students to actually view. It's ideal to be able to show students this is the type of quality care we would expect them to be able to provide for their patients.
Hello, good evening. It's Darwin Ward.
The phoning is so important. Students need to understand that they need to answer the phones correctly. They need to say who they are. They need to liaise really between the person who's on the phone, who's desperate for information and want to know how their loved one is, but also the patient in bed who may be thinking, oh, thank goodness, what I need is my slippers. Please bring in my dressing gown as well because I haven't got that, or I want some orange juice. Could they bring that? And they can give that information.
Well, I've got a message from her. She said to me that she is looking forward to seeing you. She's very well at the moment, so you can visit her anytime.
You know, we spend such a lot of time developing those clinical skills and those simulation exercises. And then when the students come in and you can just see the growth in them and that they feel so confident when they go out, and it's the excitement in their own faces that, like the student today who could suddenly for the first time has actually managed to hear that blood pressure. That's significant for her. She will take that away with her.
Okay, let it down slowly using your gauge.
And instead of focusing on just doing the blood pressure, next time round you'll be able to speak to the patient rather than just focusing on the skills.
Because it's their blood pressure, so it's nice to say, well, your blood pressure's
124 over 52, that's fine.
Okay.
You know, it's all within the normal range. Thank you very much.
All right. Thank you very much, Mary.
Thank you, Mary. Thank you.
I get a real passion for this. I think it is seeing the growth of the student from a first year through to a third year, from somebody who felt quite novice at the beginning, who feels quite anxious, not sure even how to introduce themselves to a patient, to somebody who walks into the labs. You can see leadership, you can see decision-making skills that they've developed over those 3 years.